Assalamu alaikum. Welcome back to Hilaal Live. Thanks for watching us. And as we do on a Friday, we talk about all things health related, allowing you to get a little more advice with regards to some of the issues, challenges that you may find in your life. Now, today we are chatting about orthopedic injury management, and we're going to chat to a biokineticist. Often enough, you often hear of, back pain issues, and a strong majority of the world's population, and it's estimated that every human will at least in some point in their lives experience back pain or some type of form of back irritation. Now, this amongst their common orthopedic injuries, such as a knee injury or a shoulder injury, or even sometimes sports people have various ankle injuries as well. Now, these are regular occurrences for the average human body, whether it be a sporting or a non-sporting injury as well. So in studio, I'd like to welcome Brother Fayaadh Dhansay, who's a biokineticist. Assalamu alaikum, welcome.
Wa alaikum salam. Thank you very much for having me.
My absolute pleasure. Now, I'm sure a lot of our viewers are very interested with what a biokineticist does. I had to practice that word a few times, so don't mix it up. Give us more information in terms of what is your responsibilities as a biokineticist.
Okay, so a biokineticist, by the simplest definition, is an exercise therapist.
Okay.
In that we are healthcare practitioners who use exercise as a treatment modality for any number of conditions, whether it be sort of, as we mentioned, orthopedic or sort of other medical conditions, stroke patients or special conditions or populations, people that are struggling with multiple sclerosis and things like that. So anything where exercise can potentially help you improve your function and your quality of life. And so, we are HPCSA registered healthcare practitioners using exercise as medicine is the sort of term. Yeah,
that's fascinating, because I've always wondered what a biokineticist does. I thought it's a fancy name for some other type of treatment.
Yes.
But when one makes an appointment at a professional like yourself, yes. I mean, what is the process? I mean, take us through an average day of a biokineticist.
So in general, when any new patient would come in, we would obviously go through a little bit of a history of the injury or the condition. We would discuss in quite a bit of detail lifestyle factors, causative factors of the injury, really get a big sort of picture in terms of understanding the issue. Okay. Following that, we would then do an observation of maybe their posture, their movement, the issue or their injury, to get a deeper understanding physically. Mm-hmm. We do a little bit of poking and prodding as well to understand what is happening with the body physically and physiologically. Mm-hmm. And there are some sort of specialized clinical tests to help us sort of identify what structures might be involved and not involved. And that's sort of the initial phase, assessment and consultation. Mm-hmm. Following that, usually there would be a process of sort of it's not just a simple 6 exercises and then your problem is fixed. It's a bit of a process of, we call it induction,
Gotcha.
Teaching, education, demonstration, getting a bit of feedback, seeing what works and what doesn't. And then you sort of build you a science-based rehabilitation program, suited to your specific requirements.
Brilliant. It sounds very fascinating. And I'm sure no 2 days are the same.
Oh, no. Different people, different conditions all the time. Within our practice, we focus on more orthopedic injuries, as you mentioned, though the scope of biokinetics does expand a little bit beyond that. But very exciting and interesting.
So maybe give our viewers a better understanding on how we could better understand how to manage some of our injuries. And when do we actually seek medical advice? And when it comes to medical advice, who should we actually go and see? I mean, do you package all of that for your client?
So I think I'm going to answer your second question first, if that's okay.
Sure.
When you are, struggling with something, let's call it back pain. Use that as a practical example. Generally, most people would go to sort of their first port of call is their GP,
right.
Their doctor. And that is perfectly fine. They would become your case manager, and they would then do an assessment and give you a treatment intervention, whether it be in the form of medication, which is usually the case with GPs, and if they find that you could benefit from the treatment of a physiotherapist or a chiropractor or a biokineticist, or it's something more serious and you need to be referred up to an orthopedic specialist, they would sort of be case managers and then assist you with that. But the GPs are not your only sort of frontline practitioners. While they are primary in that they can diagnose and they can prescribe some medication, physiotherapists would also be considered primary healthcare practitioners, treating pain, helping you within that acute phase. Chiropractors also fall into that same box, and so they sort of all would be good options. But when we're speaking about back pain, I would lean in the direction of physio or chiro as sort of that first, manage the pain, get the inflammation down, get some movement back. Biokineticists come a little bit later in the process. And this is because we do mostly final phase rehabilitation. After your acute symptoms have settled and you really want to get back to full function, whether your function be work or play or sport or whatever it might be. So that's sort of the order of things. That's who you would see. And then the how to manage injuries on your own. I think this is something that hopefully the viewers can take home and keep with them for the rest of their lives. It's a really good way to rationalize what is happening with your body and how you can manage it. And the simple understanding is, if you can understand what has caused your issue, you have a very good way to start dealing with that problem.
Absolutely.
And so we look at three main sort of factors as causative factors for your injury. The first one being intrinsic factors. So this would be you. It's your body, your strengths and your weaknesses, your age, your gender, your metabolism, your muscle length and strength, and your joint health, all of those things related to you and your own body. And so you can take that into account and say, okay, well, I'm younger, and so I shouldn't be really dealing with this, but it must be something else, or I'm coming of age, and so now there's expected degradation, and I haven't been training, been sedentary for a few years, so my muscles are a little bit weaker. So you could look at that box of intrinsic factors. We would also look at extrinsic factors. So this would be things like, your equipment, if you're playing a sport, if you're running the surface that you're running on, anything sort of environmental acting on your body. So the temperature on the day can have an effect on your risk for injury. Of course, there are other systemic things like smoking or medication that can have an effect on your physical or physiological self, and that could then also be a potential causative factor for injury. And then there's another little box, and we call that training factors, or I like to call it load factors. How much are you doing? So there's this concept called the FIT principles, the frequency, intensity, type, and time of training that you might be doing. But again, I said training, but I like to call it load, because sitting is a load as well. And so sitting for 3 hours is a lot of load. And if you're doing that every single day of the week, that is still a load on your body. And so it can have an effect on your body. Of course, if you're training, you could be training too much. So those FIT principles as loading factors could be important. And then, of course, your total volume of training and your progression into that volume, and the potential of excessive mechanical loading being a causative factor for your injury. That sort of, covers the load factors to consider when it comes to understanding where my injury came from. And so we have this intrinsic, extrinsic, and training factors. And if you'd like, think of it as a Venn diagram, and these factors overlap nicely, and when everything is in balance at their overlap, you're relatively injury-free and your body is healthy and well. But should any one of these areas be sort of lacking or being be deficient, it could be a causative factor that pushes you into a higher risk of injury.
Sure, that's wonderful information that you've shared. It's a lot to take in, but there's a process, I would imagine, that you follow. Obviously, trying to let our viewers know in a short space of time of how you manage all of this. And I would imagine working closely with GPs, working closely with fitness, like Askab Job, who comes in on a Friday, who is a personal trainer. You work quite closely with these type of professionals?
Yes, all the time.
Okay, and then they would then refer you and say, you know what, my client is not feeling so well in a certain area, and this is the process you would take.
Exactly.
I'm with you. Okay, so now I understand what a biokineticist does, because more importantly as well, the end result is what you would be working towards, and that could take anything from a month to 6 months.
Yes, if it's a simple injury, you've rolled your ankle, you could be out for as little as a week and be back in action soon thereafter. But if you've had a major injury like a torn ACL, a ligament in your knee, we have well documented evidence, sort of research-backed evidence showing best case scenario for healing and recovery and loading, sort of optimal loading to get stronger. And that's going to take you 9 to 12 months to get back into full action. So certainly condition dependent and individual dependent, of course.
I mean, some of these injuries as well, if it's not treated, can then have serious effects later in your life.
Yes, and I would put it down to, well, number one, longevity, number two, function.
Yeah.
So everybody wants to get rid of pain, right? Pain and function are your two primary outcomes. You always want to fix that first, but we do have the option to get that little silver bullet to get rid of the pain, but that doesn't necessarily mean you'll be back at full function. And this is part of the reason why biokinetics exists in the first place.
Sure.
If you don't mind a short history lesson on biokinetics.
So I'm gonna ask you to give it to us after the break, because I don't want to interrupt your pertinent information. We're going to take a short ad break. We're chatting to Fayaadh Dhansay, who is a biokineticist, and giving us valuable information on how the world of biokinetics work and how crucial it is to your healing process as well. Do join us after the break as we chat more to our guest in studio. You are still watching Hilaal Live. Assalamu alaikum. Welcome back to Hilaal Live. In this segment of Hilaal Live, we're chatting to a biokineticist around the world of biokinetics and just how to manage some of the issues, challenges that you are faced with. Brother Fayaadh Dhansay in studio, giving us valuable information around this very pertinent topic. Brother Fayaadh, Jazakallah so much once again for coming into studio and sharing this information as well. One of before the break, you were going to explain to us a bit of the history around biokinetics and how this all comes together as well. And I'm sure our listeners, as I am, very fascinated to know more about that.
So my previous story was about us as human beings, as patients, as people who tend to prefer to just get rid of pain and then it's done. And that was sort of the go-to treatment modality in South Africa, I suppose. A good few decades ago. And about 40 years ago, we realized that the practitioners that we had were doing a wonderful job managing pain, managing acute symptoms, but people were going from the treatment table back onto the sports field or back into full work. And this was unfortunately not necessarily enough. They had the ability to go back, but their body's capacities were not quite there. And so it created a little bit of a gap where someone needed to take over the reins and say, okay, I'm going to build this body up, get it stronger, more stable, more flexible, more mobile. And biokinetics was created about 40 years ago in South Africa.
Wow,
in
South
African
Africa?
Profession, yes.
That's amazing.
And so I know you had a question earlier on about, would your qualification be recognized anywhere else around the world? Currently not, because it's a South African sort of invention, but it's well respected around the world. Often in Europe and the UK, for example, you have exercise therapists and you've got sort of these alternative professionals who do similar things to what we do, but are not necessarily as qualified and also not registered as healthcare practitioners. And so we are considered a little bit more qualified than them and can provide a little bit more support to athletes, to non-athletes. And so there is a lot of recognition, and there are a lot of bios that have moved overseas and created organizations in the UK, in Kenya, all around the world to create a little bit of representation. And the next phase, inshallah, will be to actually then become recognized. There is one profession called a clinical exercise physiologist, and that exists in New Zealand. And it's practically a copy-paste of what we do. And so there is a bit of crosstalk there where we could do some sort of, exam to get their qualification and then practice there. But these are all, work in progress at the moment.
Of course. So 40 years ago, it was created in South Africa. I mean, that's just phenomenal. I didn't know that. How long do you study for? I mean, is there a process in terms of how you get into the industry?
Yes. So in my day, a decade and a bit ago, it was either a BA or BSc degree at university. That would be 3 or 4 years, depending on which path you took. But it would be a degree in human movement science or sports science. pretty much each of the provinces in South Africa have a university or a few universities that offers this. You would then need to do an honors in biokinetics.
I see.
And once you've completed your honors, a 1-year internship in biokinetics, because you need clinical hours to support that before you become qualified. More recently, they have, some universities have adopted a slightly different program where from year 1, you go all the way through to an MPhil in biokinetics.
Sure.
And so I couldn't tell you offhand which universities, but those are sort of the two options.
Okay.
Undergrad, postgrad, and internship, or one path straight through.
And do medical aids recognize this treatment or your services?
Yes.
Or is this regarded as specialized treatment or...
It is a little bit on the outer banks of treatment. It wouldn't fall under any of your what's called PMBs, primary minimum benefits. So physiotherapists would be able to access some of those and other practitioners, but unfortunately we don't. However, there usually are allocations for biokinetics and physiotherapists and podiatrists. We fall under the same category under the HPCSA, and so medical aids would recognize us and would cover our services up to a certain limit, to the availability of your fund or your savings. So yes, we definitely are recognized in that way.
So a typical patient comes into you and they said, listen, I've had this injury for a while. I've got serious back pain. Take us through the process, and I would imagine that's one of the common, occurrences of a patient coming into you. What are some of the analysis that you would do in order to get them where they need to be?
Okay, so we would, as mentioned earlier on, start with a history. We would observe their movement, not just general complex movement, but isolated movement, the level of the joints and the surrounding joints, and really go through a detailed analysis of what state their body is in, the cans and the can'ts, and what provokes them and what relieves them, really build a big picture of what's going on. And then we have specialized tools as well that we use to measure force production, to identify where your strength deficits might be, or imbalances between, left and right, or between an agonist and antagonist muscle pair. And we can reference the research and say, well, we know that your hamstring versus your quad should be at 50 to 80% as a strength reference. And if not, we can help you build up to within that healthy sort of ratio. And so we use a specialized tool to measure, and I want to use that as a keyword. We measure as much as we can. And once we've got measurements, we've got your baseline. And then we set outcomes. This really is a science-based model. We set outcomes and then reverse engineer a program to help you achieve those outcomes.
Amazing.
And once you do, we progress you on to the next phase of rehab and onto higher levels of function. That's sort of how we do it.
Has there been any resistance with regards to your type of industry? Do you find people accept it easily, what you do? And has it changed over the last 10, 15 years?
I would say that we've become a little bit more fashionable, for lack of a better term. It is almost cool to be seeing a biokineticist these days.
This is what I'm saying,
which is obviously it's beneficial for us. It's entertaining as well.
I have a guy,
Yes, exactly. We did initially, in the early days, when they were still busy defining the scope of practice, there was quite a bit of overlap with physiotherapists and a little bit with chiros and personal trainers. And so there was a little bit of friction and back and forth. But more recently, as our organizations have been speaking to each other and practitioners are referring within inter-referrals between themselves, we realize, physios are really valuable for this part and we need them. And they realize that, they do a little bit of exercise, but we only do exercise. And so they really need us for that next phase. And so it's improved quite significantly over the last, I would say, decade or so, especially in my time in practice. And we work really closely with other practitioners. And so now I would say things are a lot smoother. And of course, it's still a work in progress. And there's always a little bit of friction here and there. For the most part, it's improved significantly.
And the advice, medication, or I wouldn't say medication, but in terms of the equipment that you use or the processes that you use in order to get the client where they need to be, has that changed? I mean, has that evolved? I suppose
technology has been somewhat helpful.
Okay, great.
We use, exercise prescription software to prescribe homework programs, but they're really smart these days.
I would imagine.
You click start and a timer runs and it tells us how long you've spent doing that program. So there's no shortcuts anymore these days. So there are tools that assist us in helping get, patient compliance, and that helps them achieve the outcomes that we set out. But the alternative is, of course, going old school and just coming to see us more regularly. If you've got the time and the logistics and financial abilities, then that's always an option as well. Then we can supervise things, step by step. There's an alternative.
Often enough, and I'm sure you probably get this a lot as well. I've gone to Dr. Google, I've realized and I've estimated what my challenge or problem is. You need to now do this. Do you often get that?
I would say 9 times out of 10, yes. But I would liken it to me working on a side project right now where I need to do a little bit of data analysis. And I didn't go through the process of studying data analytics and qualifying with that and being, entrenched in a day in, day out for years and years and years. And so other than the surface information, the deeper levels of understanding and the nuances of, in this case, how the human body works and how mechanics, sort of works, it unfortunately it doesn't exist for your average Joe, and that's okay. It's perfectly normal, and we sort of live for this. It's my everyday, and so we tend to sort of put forward, let us handle the complicated stuff, because we live for this, and leave Dr. Google alone for now. Of course,
I think most health professionals often face the same issue with because there's so much information on the internet these days, that people tend to self-analyze and then sort of also self-medicate to a large point as well. And it could maybe lead to harmful, repercussions if not treated properly.
Yes. The convenient thing about exercise as a medicine, exercise as a treatment modality, is that it's generally beneficial to do exercise. And so while, if you do have a weakness and a muscle that may be a little bit longer than what it should be, and Google says stretch and you stretch and make it longer, it could theoretically work against you. But it wouldn't necessarily be as risky as maybe taking the wrong medication. So I would say that we work in a slightly lower risk space than other medical practitioners would be working in. So yes, often we do need to do some corrective work, but it's not always that bad.
What's our take home from speaking to a biokineticist? So what message would you like to actually tell our viewers and to the general public about your profession? Maybe some myth busts, if there are any.
About the profession, I think I've covered enough detail about the profession, but I do like to leave all of my patients with a bit of a take-home message. Move.
Nice. Okay.
Move. Exercise in any way, shape, and form. It is better for you than not exercising.
Yeah, I know you've got introductions of standing desks these days. You've got people sitting on those big balls. What do you call them? Those exercise
balls, yes.
You've had people that, they often say sitting is the new diabetes, things like that. So there's a lot of things surrounding how we should actually move more.
Well, you asked for some myth busting. I'm going to put forward a statement that you might consider a little bit of a myth bust or a paradigm shift in understanding. The concept of posture, as we are sitting here, we've been sitting for quite a while. We've always been taught sit up straight, shoulders back, tuck your chin, sit with upright, perfect posture.
I'm bad at that.
My message is going to be, there is no such thing as bad posture.
Okay.
The problem is not so much the posture or position that you're in. It would be the load applied. And so in the case of sitting, it's about the time spent sitting.
I see.
If I'm sitting like this for 3 hours, it's bad for me. But sitting like this for 3 hours is bad for me too.
As well, correct.
And so certainly there are positions that add more strain to certain structures, compared to others. That's a given, that's obvious. I'm not denying that. But the problem is not that position. The problem is the time spent. And so the best posture is the next posture.
Gotcha. Thank you so much, Fayaadh. It's been an absolute pleasure having you in studio, gaining some of the information that you've given us. And could people find you on all the good socials?
Yes, we do have an Instagram and a Facebook, and I couldn't tell you the handles offhand, but I can point you to our website. It is www.drbio.co.za.
Gotcha. Jazakallah once again. Have a wonderful weekend.
Shukran very much for having me. Wa alaikum salam.
My pleasure. And that's Fayaadh Dhansay in studio talking to us about the world of biokinetics and educating us on some of the valuable treatments that's out there. That's how we round up for the week on Hilaal Live. We're back on Monday, inshallah, between 5 and 6. Don't forget to tune into Faraz and the team at 6:30 in Johannesburg, where they bring you all the latest as well. From myself, Luqman Shadrack, and Sohail Barnes right here in Cape Town. Have a great weekend. Assalamu alaikum.